right, well, welcome everyone. We'll go ahead and get started, and others can join in as time goes by. I am Dr. Cherie James, founder and owner of BMI Wellness Concepts, and the B stands for body, M for mind, and I integration. And we are a holistic wellness company to help you discover other ways to treat some common conditions, or other ways to just stay healthy and well. Now, notice I am wearing purple. Again, that's not by accident. Actually, purple and green are the colors of the company, of BMI Wellness Concepts. But purple is also the color of the National Alcohol and Drug Addiction Recovery Month, for which September is that designated month. So once again, thank you for joining. So this presentation today is going to be a little bit different format from the one last month. And thank you for those who joined us last month when we talked about the new weight loss injections or medications, do's and don'ts. So every month we will speak on, I will speak on a different topic. All righty, so next slide. Can someone, so this event will be more interactive. So I'm gonna call on people, and just please feel free to volunteer to answer some of the questions. So one of the first questions is, all right, can anyone name common substances that are frequently abused or with a high addiction potential? Is it a way to mute the music? All right, so the first question of the day is, can anyone name substances frequently abused with a high addiction potential?
Alcohol and cigarettes.
Excellent choices. Anybody else? What's all in the news lately over the last several years?
Opioids and methamphetamines.
Absolutely. And what's one of the hot topic opioids right now? Sadly, there was a 1-year-old who died in a daycare that was running a drug ring through there.
Fentanyl.
Yeah, absolutely. So there are a lot of substances. Again, nobody mentioned as well things like benzodiazepines. Because someone mentioned alcohol and cigarettes.
Cocaine.
Cocaine. So there are a lot of medications out there, and actually, alcohol and drug addiction is actually an illness or a diagnosis or a disease. It is very hard. Some of these illicit substances, they work on the brain on certain craving centers of the brain. So once you're addicted to get used to them, it's really hard, and it's an art or a technique to recovering from substance use disorders. All right, next slide. All right, so now to get down to the nitty-gritty with some numbers. So presently, over 14 million Americans suffer from alcoholism, and that's defined as 3 or more drinks daily, or 7 or more drinks weekly for women, and 4 or more drinks daily, or 14 or more drinks weekly for men. For over 14 million Americans suffer from binge drinking, which is defined as 4+ drinks on occasion for women, or 5+ drinks for men, or alcohol abuse. And that just basically means drinking too much alcohol too often, which interferes with your daily life. And of that number, also in the U.S., we have 46.3 million Americans aged 12 or older. So a lot of people start getting addicted or drinking alcohol at the tender young age of 12. That includes 16.5% of the U.S. population met the criteria for substance use disorder. That can be opioids or nicotine in 2022, including 29.5 million having an alcohol use disorder and 24 million having a drug use disorder. And we already mentioned that synthetic opioids, namely fentanyl, accounted for 68% or 107,081 drug overdose deaths in the US in 2002. So those are some pretty alarming numbers. But just like those are pretty alarming numbers, the numbers for recovery are just as outstanding and provide hope. So there is hope. Just because you may be addicted, or you may know someone who's addicted to an illicit substance, does not mean that they can't get off of that and recover and remain in recovery. So 36% of people suffering from alcoholism recover after 1 year. And after 1 year, approximately 18% of recovering alcoholics achieve what's called low-risk drinking, and that is less than 3 drinks a day for women and less than 4 drinks a day for men. And approximately 18% of recovering alcoholics abstain from drinking completely 1 year later. And then there's significance to the 1 year and the 5 year marks. Those are important sobriety milestones. So basically, if you get to 1 year of being sober, you have a 40 to 50% chance of remaining sober. If you get to the 5 year mark of remaining sober, then you have a greater than a 90% chance of maintaining sobriety. And then approximately 60% of recovering alcoholics who are sober for 2 years after treatment successfully remain in addiction recovery. Then there are more than 20 million Americans recovering from substance use disorder. So in other words, there is hope. Now, I mentioned earlier about holistic or natural recovery versus treatment. And there are differences in when we talk about a treatment versus holistic recovery. So treatment per se can be sporadic or intermittent and can be repeated indefinitely. So treatment sometimes without treating the entire person or putting the person in recovery can sort of be an example of what's that definition? The definition of insanity, where you keep doing things the same way and expecting a different outcome. But in this case, you keep treating the person, but you're not treating the whole person, or you haven't discovered the root cause of the addiction. So then you're going to keep getting the same outcome. Whereas recovery is an ongoing journey and a lifestyle change. And with recovery, we really base it on progress as to how well you're doing rather than perfection. So you don't have to say, oh, good, boom, it's been a year now, and I'm not expected to relapse. As long as you're making progress, that's what really counts. So holistic or natural recovery usually occurs without synthetic treatment or medications, and treats the root cause of the addiction and the whole person, not just the symptoms. So hence is the motto and the mission of BMI Wellness Concepts. Remember, we said BMI stands for Body, Mind, Integration Wellness Concepts. And you'll often hear me say, and you'll often hear posted on my Facebook posts and social media posts and on the website, our motto, which is get well, be well, stay well. Our mission is to assess the root cause of your symptoms or disorder and utilize holistic or natural remedies with fewer to no prescription drugs in order to promote health and wellness and prevent illness. And once again, like I said, our colors are purple and green, and addiction recovery national color is actually purple. So you'll notice purple throughout all the slides. All right, so now it's time for, let's see, if you can play some addiction Jeopardy. Anybody can shout out an answer, and try not to look at the slide. Can you name some root causes of addiction?
Trauma.
Yes.
Stress.
Yep. All right, so we'll look at the slide. So of course, chronic stress, a history of trauma, mental illness, like depression and anxiety, a family history or genetics or learned behaviors. So it's common a lot of times for, and I'll share a little bit about my personal family history. One side of my family has a history of alcoholism. So it's only a few of the siblings, it was 10 total, and probably about half of them did not end up alcoholics, while the other half did. So they're good. A lot of it becomes a learned behavior. I remember growing up, my granddaddy making his own liquor with peach hulls and other fruit skins. So a lot of that becomes a learned behavior. Or genetics plays a huge part in it. And there are also different industries that, for example, in the business industry or Wall Street or a high pressure job, there's a huge prevalence of addiction or alcohol use disorders. Also in the art and entertainment industry, and it's unfortunate that sometimes I think people think that that's part of the course that goes along with that job title. And personality traits, like 10 to 15% of people have addictive personalities. And when I say addictive personalities, I mean they can become addicted to aspirin, anything. Just some people just have that personality type. And one of the big addiction root causes within the past 3 years has been, can anybody tell me? COVID. What happened during COVID?
Everyone was stuck in that.
Right, we were on lockdown. So we're on lockdown without the ability to go out and exercise, breathe in fresh air, just touch somebody, talk to other people, share what you're going through. A lot of people felt isolated and trapped. And especially if they had any alcohol in the house, any drugs in the house, they started to rely on these as stress reducers or anxiety reducers. And even during COVID, like people like DoorDash, Uber Eats, etc., were considered essential workers. But one thing that happened in a lot of states, including the state of North Carolina, is they had home delivery of alcohol. And alcohol is one of the biggest depressants, and alcohol is one of the most commonly substances that is abused. So you have isolation mixed with delivery of alcohol, and it makes for a bad mix. Now, we mentioned about holistic approaches. So I'm pretty sure, well, not pretty sure, but some of you may have heard of some treatments, things like Vivitrol or naltrexone to treat alcohol use, and as well as opioid use disorders. There's something called Suboxone. So there are different Suboxone treatment programs, and those treat opioid addiction. So there are a number of and there's things like Alcoholics Anonymous, Narcotics Anonymous, or other therapy or treatment groups to address alcohol and drug addictions. But there are also nutritional steps you can take to aid in recovery. And these things include things like low-fat foods, increasing the protein or complex carbs and dietary fiber, vitamins such as B complex, B1, thiamine, vitamin A, and vitamin C for alcohol abuse and alcohol withdrawal. So I don't know if any of you know anyone who's gone through what's called DTs or delirium tremens, or when they're detoxing off of alcohol. So that's part of the medication that they put in, they hang in the IV bag. Vitamin D helps with opioid addiction recovery. And there's certain minerals like zinc, calcium, and vitamin D that help with benzodiazepine addiction. There are certain herbs that help treat and control triggers, like ginseng helps control triggers associated with opioid use. Milk thistle helps control withdrawal symptoms. And then you have things like burdock root, dandelion, and hawthorn berries, which help treat and control triggers as well. Nuts. So certain nuts are high in fatty acids and calcium. So for example, walnuts are high in fatty acids, and they're good for cocaine recovery or cocaine addiction. Also, almonds are high in calcium and healthy fats. Those are good for alcohol use disorders. And Brazil nuts, which are rich in selenium, help supports liver detox. And carbohydrates such as whole wheat bread or a cup of rice help increase insulin levels, which help with withdrawal symptoms and prevents relapse. And other things you can try are foods high in sulfur and antioxidants help to detox the liver. And these examples of these foods includes things like garlic, onions, broccoli, Brussels sprouts, lemons, prunes, plums, cantaloupe, and apples. And then foods rich in antioxidants, magnesium, and omega-3 fatty acids help repair the lungs from smoking, including smoking crack cocaine. Also, leafy vegetables, flaxseed, salmon, chia seeds, berries, and kidney beans and pinto beans also are rich in antioxidants and help repair the lungs. And it's sort of like with nicotine addiction. If you can stop smoking, we're always taught in medical school that if you can stop smoking for 5 years straight, if you were to do a chest x-ray on the previous smoker and a non-smoker and then put the two side by side, they would look exactly alike. So there's benefits to stopping smoking and also decreasing alcohol intake and sobriety, because your numbers and your chest x-ray, for example, will look just as healthy as a non-smoker or non-alcoholic. And then also more water. The more water you drink, the better to help treat addiction as well as intoxication with withdrawal symptoms, mainly because dehydration is a common side effect of addiction. So it's sort of like when you drink more water, you're diluting the effects of the substance itself. For example, if you drink alcohol, is in itself a diuretic, makes you pee off water. So you have to replace the water. You just can't start in a negative water balance and drink alcohol. All right, so some other holistic therapies include the 1-2-3 drinking rule. 1, no more than 1 standard drink per hour. 2, no more than 2 standard drinks per occasion. And 3, never exceed 3 standard drinks per occasion. And a standard drink is defined as 5 ounces of wine, 12 ounces of beer, 8 ounces of malt liquor, and a 1.5 ounce 80 proof shot. Now, we mentioned briefly about seeing a therapist or psychiatrist or Alcoholics Anonymous and Narcotics Anonymous, but there are also other things that you can do, something called mindfulness and meditation. So has anybody heard of mindfulness and meditation?
Yes.
All right. Can you tell me what mindfulness means to you?
I think mindfulness to me means being aware of your feelings and everything that goes on in your mind, maybe your cravings or addictions in that sense.
That's absolutely correct. Mindfulness can also mean, for example, if you're in the process of meditating, it can also mean being aware of your breathing, being aware of the surroundings, the sounds, and the things you're looking at. So can anybody give me an example of meditation or define meditation for me? Okay, if nobody wants to speak up, I'll just say that meditation means you just shut out a lot of the external stimuli like sounds, the sights, sometimes smells, and you focus. Whether you're sitting in a secluded room or a dark room, and there are different types of meditation, and we'll talk about the different examples of meditation as well. So I want everybody to participate in this mindfulness exercise. It's a breathing exercise. So there are different types of mindfulness or breathing exercises that really help with addiction recovery. So once again, here we are at the numbers. So there's something called a 4-7-8 breathing technique, a 4-4-4 or 4-2-4 breathing technique, and there's something like a 5-4-3-2-1, something, a bunch of numbers. So what we'll do is we'll practice the 4-7-8 breathing exercise. What that means is you're gonna take a deep breath in for a count of 4, then you're gonna hold your breath for a count of 7. However, you still feel yourself getting a little dizzy or lightheaded, just hold it for a count of 4. And then you're gonna exhale, making that whooshing sound and go through pursed lips for a count of 8. You can repeat that up to 4 times. And when you're doing this, pay attention to what's going on around you, and make sure you completely fill your stomach and your lungs with air and completely empty them out. So everybody get in a comfortable position. I'm seated up in the chair. You can get in the Indian TP stance if you want, but I know if I get in that stance, it'll be a long time for me to get out of it. But anyway, so I'm going to sit with my chair, with my back to the back of the chair, and then there's a certain pose for meditation where you touch the index finger or the middle finger, but mainly the index finger to your thumb, and close your eyes. And then we're going to breathe in, take a deep breath in on a count of 4, and so I'll do the counting, and then we're going to hold it for a count of 7, and then breathe out for a count of 8. Is everybody ready? And get yourselves in position and close your eyes. Try to block out any other external stimuli. So I'm going to breathe in and count of 4. 1, 2, 3, 4. Hold it for a count of 7. 1, 2, 3, 4, 5, 6, 7. Now breathe out on count of 8. 1, 2, 3, 4, 5, 6, 7, 8. Good. Keep your eyes closed. We'll do it one more time. 1, 2, 3, 4. Hold it. 1, 2, 3, 4, 5, 6, 7, 8. Then the exhale. 1, 2, 3, 4, 5, 6, 7, 8. You can open your eyes. Does anybody care to talk about how that made them feel? Besides lightheaded. We get a volunteer, Miss Ariel Lamille. All right. Well, I know that made me feel, today has been a long day, and it made me feel a little bit somewhat cleansed, and enabled me to bring it down a little bit and reflect a little bit on my day-to-day, and help me to realize that this too will pass. We're at the end of the day, and it can only get better from here. And it gave me a piece of a sense of peace or serenity, and sort of made me feel like I cleansed my soul or my insides. All right, so remember I mentioned the different forms of meditation that are beneficial to addiction recovery. So one form is prayer meditation. So some of you may have heard of the serenity prayer, and then there's one called the third step prayer. Does anyone care to read the Serenity Prayer?
I'll read it.
Mm-hmm.
God grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference.
Yes. And that sounds, I think that's who's speaking? Is that Caleb?
Yes.
And then do you have an example of how you put into practice the Serenity Prayer?
For me, I know there's some things I can't control with basketball wise when it comes to coaching and stuff like that. So I could use this prayer to help kind of change my mindset of things and think of things differently.
This is a big deal. Champions round.
Very good. That's an excellent example.
So we are going to make.
Anybody else want to share an example of the Serenity Prayer, how they put that into practice?
What if we did? He wants to play this. The kind of thing.
And a good for any background noise, can we have mute the background noise?
Filling stage, toasted marshmallow cream and chocolate ganache.
All right. And then there's the third step prayer. Who wants to read that for me?
I can read that.
All right.
God, I offer myself to thee to build with me and to do with me thou wilt. Relieve me of the bondage of self that I may better do thy will, take away my difficulties. That victory over them may bear witness to those I would help of thy power, thy love, and thy way of life. May I do this will always.
Okay. And so if you're, I know with me, I have a difficult time sorting through all the thys and these or what have you. But the Serenity Prayer, there's a quick short one where you don't have to go worry about the these and the thys in the biblical sense. And also, if you may be spiritual but not necessarily religious, the Serenity Prayer is a good one as well. All right, then the mantras. Who knows what a mantra is? All right, so the mantra is as a phrase that you can repeat to yourself during meditation, or just repeat on several times during your day. And some examples of mantras that help aid in addiction recovery include things like I am worthy of recovery, progress, not perfection. I am in control of my own life. I choose to be sober today. Remember, sobriety is a choice. So a lot of my patients may be addicted to drugs or maybe alcoholics. The first thing I ask them is, why are you here? And are you ready do you want to make a change? If the answer is no, or either I'm here because so-and-so made me come here, the court system made me come here, then I leave it alone, because the person, you have to choose to want to be sober. And it's okay if you're at a point in your life where you're not ready yet, but hopefully one day that time will come around. Another example of a mantra that's helpful during addiction recovery includes, I choose to be happy today. I am right where I'm supposed to be. We may not know what our plan in life is, or what course what path we take, but rest assured, you're right where you're supposed to be. I am not alone. I am stronger than my addiction. I can and I will. I am strong and capable. I'm on the right path. And one I like that's not on here is, I like the person I am becoming. You've got to like yourself to get through recovery. All right, so now we're getting back to our other sharing stage. Does anyone have a story they'd like to share? It doesn't have to be a personal story or either a family member or what have you. It could just be a situation you may have heard on the news that you may be aware of. And if you share a story, it'd be a good idea if you can make some good suggestions as to how they can apply holistic therapies to aid in their recovery. Does anybody have a story to share?
I could share a story.
Okay.
So when I was in college playing football, I had a lot of teammates that were addicted to different substances, from like nicotine to even marijuana. And I think a lot of drug tests came around, and it was a choice of whether you choose your career and continue to finish your education, or you choose weed. And in that situation, like, a lot of people had to choose weed and choose a different, had to choose their education and give up weed in that sense. And so like one of the ways that mindfulness helped, we had a mental health coach come to our team, and she actually taught us a bunch of different mindfulness techniques. We meditated every day before practice. We actually, the breathing technique that you showed us today, we taught about a similar one where you breathe in. We kind of did it every day before practice, every day after practice, and that kind of helped control and have, like you said, mindfulness and understanding of where your feelings are, where your head is, and kind of like gaining control of that. So that really helped a lot of people on the team.
All right, very good. And I agree, sometimes we get to a crossroads in our lives and our careers where we have to make a choice. So I have a good friend. He's no longer with us, but he was an attorney, and he had to make the decision. Does he continue? So the weed and alcohol started in college. So he had to make the choice of because he was called on the carpet by some of his partners in the law firm and superiors. He had to make the choice: do I continue with weed and alcohol, or do I remain in this practice? So fortunately, he chose to remain in the practice. And it's okay. Sometimes we are forced to make certain choices or decisions. But the thing is, like Malcolm X used to say, by any means necessary. It doesn't matter. I got the story of the tortoise and the hare. It doesn't matter who got there first or who runs the race fastest, but the what matters is that you get across the finish line. All right. Anybody else have a story to share?
I volunteered with this organization called Mending Hearts, and they work with women who are struggling with addiction. And there is one woman who had been like in and out of so many rehabs, and nothing had really worked for her until she, like you said, decided that she was ready, and it was a choice she was making. It wasn't, like court mandated rehab or something that someone had made her do, but a choice that she decided. And for her, I don't know if she necessarily called it mindfulness, but coming to that decision was a mindful decision that she made, because she was thinking about the reasons as to why she wanted to do this for herself, opposed to who was making her do it or who was sending her there.
And do you know what happened with her after she made that decision to get sober or stop using? Had a chance to follow up to know if she remained sober 1 year, 5 years, or how many years?
I think right now she's about 6 months sober, but it's the longest that she's been a part of any rehab program. Like usually, I know a lot of rehab programs, they're like phases, and normally she leaves before the end of phase 1, but she's continued and she's in phase 2 now.
That is excellent. So she is on the right path, and I wish her much success. But if she reverts to using again, you make sure she understands. Don't beat herself up about it, because for example, those who are addicted to nicotine, the average time, the number of times it takes before they're successful with quitting smoking is 5 times. So I always tell my patients, Okay, don't worry if you try to quit smoking and then you started smoking again. You had a really stressful event. Don't beat yourself up about it, because on average it takes 5 times. And it reminds me of the story of the comedian Cat Williams, and one of his stand-up monologues. He talks about how he said got 1, 2, and 3 chances. He talks about the different he talks about the different chances or programs he's been in, but that's okay, because when he's ready to quit, he is ready to quit. All right. So if no more stories, I want to thank everybody for joining me today to talk about holistic approaches to alcohol and drug addiction recovery. And remember, let BMI Wellness Concepts be your first stop on your wellness journey to get well, be well, and stay well. So please feel free to visit the website www.bmiwellnessconcepts.com and see what we have to offer. You're welcome to sign up for a free discovery visit where we can determine what your needs are and how we can help you. Now, are there any questions tonight? And they don't necessarily have to revolve around alcohol or drug addiction recovery. They can be any question you choose.
Can you speak on marijuana addiction? Like, what might be some good routes of dealing with marijuana addiction? Is it the same, or I mean, I just find it different. As I've had several family members and tried to, they try to quit.
Now, marijuana is difficult because in some states it's legal, other states, including the state of North Carolina, is still not legal. And then what's crazy is federally, it's becoming more legal. So you have a lot of people who are locked up for marijuana use, and when they should really be released, because there's the push is to legalize marijuana. And marijuana is also difficult as well because there are some benefits to marijuana use. So far as cancer treatment, improving the appetite, anxiety treatment. But keep in mind too that marijuana slows the response time. So in some cases, especially if you're not taking it for medicinal purposes, I don't necessarily agree with marijuana use because it does slow response time. And then so for example, responding to a near accident. And then also marijuana, unfortunately, is difficult to treat because you can get a bag of marijuana for cheap. So marijuana is definitely, weed is definitely something difficult to address. And then once again, people have to, a person who may be a heavy user of marijuana has to come to that realization, sit down and realize, how is this impacting my daily life? And I often speak to patients and loved ones about marijuana use. So it depends on what state you're in. It may be legal, but if you're working a job, your job, especially with a private company, they may have rules for so far as marijuana testing and marijuana use. So you have to know all the consequences for continued marijuana use. And basically, this day and age, I get so tired, even when I'm shopping in Walmart, because the marijuana use is so common now. That's all you smell is weed. And not that I'm a weed connoisseur, but the weed these days, the smells like pure skunk to me. So and then sometimes you never know what's being mixed in with the weed. Because I can tell you stories where weed has been dusted with things like the methamphetamines, heroin, and even a little fentanyl. So people think they're just smoking a joint, and they end up in far worse shape than just smoking just a weed cigarette in and of itself. So you have to be really careful what you put into your bodies. Any more questions? I see we have a few late joiners, and that's good. That's okay, because this has been recorded. And then be on the lookout for, I'm starting a YouTube channel. So every event we have, you can find the full recorded the presentation on the YouTube channel. All right, any other questions, or anybody who wants to share anything else? All right, well, if not, thank you again for attending, and please feel free to visit the website, bmiwellnessconcepts.com.
Thank you, Ms. Cherie.
Thank
All right,
you.
thank you. Thank you.
All righty. Bye-bye.